All right, we know it's itchy, it's kind of flaky, it's kind of a nasty disease. We're talking about psoriasis, a condition that approximately 125 million people throughout the world have to deal with.
And it's really not just a skin issue. This is a systemic disease, meaning it can affect other organs in your body.
Lucky for us, we have the brand new Psoriasis Center at Uconn Health in Farmington. Take a look.
Dr. Campbell Stewart is very excited to show off the Psoriasis Center at Uconn Health in Farmington.
These are more patient exam rooms. Again, we have 12 total in addition to nursing treatment rooms here. Here we have our second UVB booth. There's a clinical trials unit here, so that's where we partner with people in the pharma industry who help produce these medications to enroll our patients into these studies, and that's how patients undergo these studies to then get these drugs to market, and that clinical trials unit is an essential part of the Psoriasis Center.
And this is a new facility.
Brand new facility, yeah. It opened up just about 3 months ago in March of 2021. And we're very excited that it's here. It sort of is linked to the primary hospital here, so we are able to provide access to more people.
For those of you wondering what psoriasis is,
psoriasis is a chronic inflammatory disorder that actually used to be thought to be restricted to the skin, but it actually is a systemic disease.
What's a systemic disease?
When something's systemic, it doesn't just affect one organ. It actually is the inflammation is affecting multiple organs throughout the body. So the skin is one of many organs within the body, and so it can impact your vasculature, meaning your blood vessels. It can affect your joints, which are the areas that help you flex and move your body parts. So those can get impacted by the inflammation that is circulating through the system.
What does it look like?
That's a great question. So normally it appears as thick red scaling plaques, particularly on the elbows and the knees. Those are the hallmark areas, but honestly, it can affect anywhere on the body, including in the private areas, folded areas, the scalp, and like I said before, it not only affects the skin, but can also affect the joints and be very painful, almost similar to rheumatoid arthritis. So it's a disorder that affects approximately 125 million people worldwide. About 2 to 3% of the population, though in some developed countries a little bit more than that. And it used to be that our treatment for this disease was somewhat limited to suppressing people's immune systems very broadly, but recently we've been able to approach it in a very different way through various biologic agents, things that are injected into people to help combat the disease, not only in the skin but in their joints and in other organs that could be affected. So it's been a very exciting 15 to 20 years in the field of psoriasis.
How do we get it?
So psoriasis is not entirely known. While we think that it is related to a trigger that happens to you during your life. It could be from an infection. Very commonly, people will develop strep throat in their youth and then suddenly erupt into psoriasis. So sometimes we think it is an environmental trigger that causes it to appear. In some individuals, it can go away, but that's pretty uncommon. Normally, once it arrives, it can wax and wane throughout their life.
And can you get rid of it? Or once you have it, it's with you forever?
It is with you forever, but you can maintain clearance through appropriate therapies.
Okay.
In addition to the injections Dr. Stewart mentioned above,
there are many different ways that you can approach the disease. One of the probably most holistic ways is to use light therapy, because not just natural light therapy, and certainly not commercial tanning beds, which are dangerous and unsafe, but light therapy is a very easy way to have a patient be exposed to a specific wavelength of light that does not increase their risk of getting skin cancer, that can really lessen the severity of the disease and the appearance of the disease.
Psoriasis on your hands or feet? They can specifically target those areas by using this machine.
This is what is called a hand-foot booth. So some patients with psoriasis develop disease exclusively on their hands and feet. And so it is the same as that bigger booth back there, but it is condensed to these areas so the patient doesn't have to get exposed all over. So hand and foot psoriasis is incredibly painful and completely wipes out your ability sometimes to walk or use your hands, which you can imagine is devastating. So this is a way that patients can put their hands into this machine for a couple of minutes and it reduces the inflammation. It's often combined with what are called photosensitizing chemicals. So the chemicals are put over the patient's hands beforehand, and then they put their hands in this for a certain amount of time to help with the delivery, just because the hands and the feet are a much thicker part of the skin.
Wherever the psoriasis is, the Psoriasis Center at Uconn Health in Farmington is the place to come.
We have all of what you would need is located right here, in addition to receiving any injections that you might need to have administered by a nurse. So your medications could be injected here for you. We have all of the light-based treatments too, and we have the clinical trials units so that everybody can get what they need while they're here.
All right, if you'd like to learn more about the Psoriasis Center at Uconn Health in Farmington, please head to health.uconn.edu/psoriasis. And that's a tough word to spell, but I finally figured out how to spell it.
But it's so great that they're coming up with new options that really help people.
Oh my God, it's so wonderful. That center there is amazing, and Dr. Campbell Stewart is an amazing human being as well.
Full of information,
Full
for
of
sure.
information,
All right,
which
so
is
check
just
it
great.
out.
Check it out.
Life-changing.